Hi, I'm Dr. Cameo Carter, board certified pediatrician. Thank you for joining me again for At the End of the Day podcast. Today's topic was a suggestion from one of my patients' parents I saw in clinic today, and we were talking about referrals and having some difficulty in finding the right referral source for a patient who has a particular need. And this is becoming more and more difficult with insurance companies paying less, with cost demands going up amongst doctors and different specialists. Oftentimes, these groups are either not taking insurance, or they're having to decide what insurance pays better, what insurance is too costly, and are refining the networks that they're involved in. And this can be difficult, particularly in pediatrics. It's hard to find specialists in lots of areas, but in pediatrics, it's becoming increasingly difficult to find a specialist who is in network and who doesn't take too long to go see. So I was talking to this parent today about something called a gap exception with insurance, and this was something that she wasn't aware of and said that might be helpful. So I'll share it with you today and the process that you can go through in hopes that that might be helpful to you too. So not only are specialists sometimes difficult to find because of their expertise, but also in pediatrics may not have an expertise not only in the subject matter, but may only see certain age groups. And so that's another limiting factor in families being able to find the right specialist. So a gap exception allows patients to see an out-of-network provider source and still get insurance to pay for it. The way that we go about doing this is first always understand what your insurance covers. I don't think this is meant to be easy, but it's something we all have to really understand about what our coverage, what is our deductible, what is our coinsurance, and what does our insurance plan say that they cover for us. So first is in understanding that. The next step is to take a list of the specialists that your doctor is recommending that you go see, as well as call your insurance and see what specialists in your geographic area are in network with your insurance. And you can consider getting a gap exception if there is no in-network provider in a reasonable geographic area, or if the in-network providers do not have the expertise for the needed condition. And again, specifically, if the specialist, let's just say you need a GI specialist, doesn't see children who's in network. So in those cases, you can consider asking your insurance company what forms they have and the steps that they follow for you to get this covered. So if you have found that there is nobody in your geographical area who has the expertise, you can then say, okay, I need to get a gap exception because this is something that you say that you'll cover for me, but yet there's nobody in my area who covers it. You can also identify who you would like to see. If they had been in network, who's that specialist that you would like to see? These two things are really important because the forms are going to need for you to request that specialist be able to be seen and paid for outside the network. So you can ask your insurance company for a gap exception form. Sometimes it's called a network gap coverage or a network adequacy exception. Those are all names that I've seen. You identify them, the specific out-of-network provider you would like to see, and then you talk to your pediatrician, or you can do this if you're an adult also, your primary care doctor, and you ask them to fill it out. And in my practice, we have an appointment where we go over this so we can make sure that we're all in alignment on that. And what that's going to require is medical justification, why care is needed, and why the in-network options are not sufficient. And then we have to give the name and the details of the desired out-of-network provider. We might need to have supporting documentation, so medical records, any notes from any other specialists, prior evaluations, any workup we've already done, examples of why we're needing a specialist with this expertise. And then it's a letter that comes from your primary care doctor that's explaining the urgencies and the unique expertise needed. That can be extremely helpful in getting a gap exception. So when that is done, then you can submit the form and any supporting documentation to the insurance company. Make sure you track timelines. Insurances usually have a required turnaround period, and that's a good thing to ask about when you're asking the insurance for the form. Is you can say what timelines are followed for this. So it's usually about a 2 to 4 week period that you should expect a turnaround time for this. And if this is denied, families should have a right to appeal. So doing a gap exception does not guarantee, but if everything lines up, if your insurance says that it covers something and there are no specialists in your area that can provide that service for you, and if there is proper documentation, which we should be able to do if we're recommending it, if all of those things line up, you should be able to get this covered and out of network. And so this can be somebody who doesn't take insurance, or it can be someone who doesn't take your particular insurance. Again, it's not guaranteed, but this gap exception can be a powerful tool to access the right care and to get insurance companies to pay for and to provide the services that we're asking for. Thanks for joining me. I hope this has been helpful to you. If you have any ideas of things that you want me to cover and discuss, please shoot me a direct message or respond in comments, and I'll look forward to talking to you tomorrow.